Plus, when you call right now, get 18 months of no payments and no interest financing. Call West Shore Home now.
Holiday savings up to $500 on Tempur-Pedic at Mermaid Mattress.
If you are watching us this morning and you or someone you know maybe is dealing with back pain, you are going to be so glad that you are watching the show today, because as you can tell, we are not in the studio, and instead we have come out the East Brainerd way to Chattanooga Non-Surgical Orthopedics, paying a visit to Dr. Jeff Hall, who years ago was a pretty frequent guest on the show. So
yes,
good to see
be
you
back
again.
On the air.
I love coming to you. We've been out here a couple of times because I think it'll show our audience today such an insight into what you do. You are, just like the name implies, not just kind of fixing things, but really to a large degree curing things for people in a non-surgical way.
Yes, that's our goal, is to increase range of motion and strength and give people their lives back.
That's hard to believe for a lot of people.
Yeah, because when people are suffering with back pain, they'll just go through the day, medicating and just being told they can't do certain activities. Mm-hmm. And so I was one of those patients when I was 22 and did not like that prognosis, because I still wanted to continue doing what I love to do.
Yeah.
So I sought out better ways to achieve healing without surgery and drugs.
So you really can relate to your patients when they come in, A, with the pain, and B, with kind of the hopelessness factor, because many people don't want to think about taking on a back surgery. So you've taken all these decades now of work to kind of create your own model.
Yes, I guess it has been that long, because
not to age you.
Right. I severely injured my back in 1994. I was down in Florida skiing, and I was a national competitor water skier, and I had a horrific injury and ruptured my L3 disc. And so, I went down the road of medication. Eventually, I was kind of told I need surgery, and I decided to not pursue that route and do another route. And so I went to chiropractic school in '95, and that kept my back better throughout my competitive days of skiing, but it never totally corrected the problem until I created these 5 steps for low back pain, and now I live free of low back pain and do whatever I want. We surf, we competitively mountain bike.
You got back on that national competition circuit, right?
Yes, but actually switched to cycling in 2009 just because I started enjoying that more.
You're primed here in the Chattanooga area because we are definitely a sports community. So there are a lot of people out there who are avid runners and cyclers and water skiers too, maybe, who are thinking, okay, this is what I've been looking for. But I imagine you also have patients who come in who just simply had a back injury and they don't know what to do.
Yes, because really all they're told is, take medication, do a little PT, and stop doing what you love to do. Mm-hmm. So if they've been an avid whatever, they're told you can't do that anymore because it's just going to re-aggravate the problem.
You like a show and tell, so you got a prop of sorts. I'll let you grab
yes.
it. But in a lot of back injuries, you mentioned that you hurt your L3. Mm-hmm. Does that mean that all that cartilage and stuff in between was damaged?
Yes, badly damaged. So there's really 2 types of back injuries. There's a ruptured disc or a bulging disc, or a facet problem. And so, yes, mine was a ruptured disc. I ruptured L3, and then what happens is the material, see that, pops out.
Yep.
See that?
I remember how you used to show me that on the air.
Yeah, so that rarely goes away. You can still do an MRI. It's still there. The scar's still there. It's still stiff, but through decompression, laser, and percussion, it'll pull that back in mm-hmm. and help it to heal up towards asymptomatic, thereby regaining strength and range of motion.
Okay, so there are going to be a lot of people who are thinking, okay, yeah, but I've heard about decompression. That's not really a new word anymore. Yeah. So I want to go back to what you said, that you kind of went in stages and you became a chiropractor, and using your own learned techniques and going to other people, it helped, but it wasn't enough. Right. So the fact that you developed this, is this a quick fix, Jeff, or do people come in and they're kind of going to work in stages and watch for the success to come gradually?
So it depends on what's coming in. Is it a 20-year-old that injured his back over the weekend? That's usually a quick fix. Or is it someone that's 65 that's had low back pain for 35 plus years and has a lot of arthritic changes, that's going to be a more long-term. They're going to have to commit a little longer because they've got more damage over the years.
When they're committing, are they coming to you on a frequent basis, or is some of this being done at home?
Typically we do all the retraining in-house, and we do Cox flexion distraction. That's typically 3 days a week. That's what this table is. And so our initial treatment plan is 3 days a week, and then once we get them increased range of motion strength, we recommend they continue to do the retrain of the muscles 3 days a week at home on their own.
I don't think you mind saying, you told me quite proudly that in the 20 years that you've been doing this, how many patients have you had to send for surgery?
Just one. So we very high success rate at treating low back pain. I've sent one out to a laser institute in Tampa because he had a extruded disc, which is where the disc breaks off totally. So sometimes they have to surgically go in there and clean that out.
How often do you still keep in touch with patients who even will call you and say, hey, I had to just let you know, I just finished doing some excursion and I could have never done it before had it not been for you?
Well, they come back in and get readjusted and say, I should have never dropped out of care, and I felt so good when I was under your care. Because, you know, just life living, we injure ourselves, and our posture's bad, we sit too much, so, you know, we're a low back pain society anyway.
So I know you wanted to focus this conversation on the back because you feel like that's not something that a lot of people really recognize in town that you have an option for. But you do other treatments here too, right? What all do you service, if you will?
So we do shoulders, knees, ankles, neck, low back, hips, elbows, wrists. If it's a joint, it moves, we do it.
Okay. In terms of making an appointment, do they have to have a referral? They can just call on their own?
They can just call in and we'll schedule them in. And then we do an evaluation and tell them what they need to regain their life.
Summer's around the corner. Are you going to go water skiing?
Surfing.
You've progressed.
Yeah, I don't want to trash my back anymore with the skiing, so I changed to surfing.
So you can find him and his very qualified staff and his personalized program that he created, the only one in town that has it. It's Chattanooga Non-Surgical Orthopedics. Yes. Their phone number there on your screen. And when we come back, we're going to touch on the shoulder work that they do here at Chattanooga Non-Surgical Orthopedics. We're back with more of our conversation with Dr. Jeff Hall in just a minute.
Order in the app for half-price cheeseburger.
One Sonic cheeseburger coming right up.
I got the ketchup.
Putting on the pickles.
Order up.
Half-price Sonic cheeseburgers every Tuesday night. Only when you order in the app.
At Chattanooga Allergy Clinic, we see firsthand how allergies and asthma can impact your quality of life. For over 45 years, we've built a medical practice that is innovative and accessible with doctors who treat you like family.